Every human being deserves quality healthcare, regardless of language or ability. Yet, across many hospitals, speech and hearing impaired patients often struggle to explain their symptoms, understand diagnosis, or follow medical advice. This documentary, Hear Our Sign Language, No More Barriers to Communication, is produced to build the capacity of healthcare professionals to communicate effectively with deaf patients. Through simple and practical sign language, we would walk through the patient's journey from arrival at the record session to the consulting room, the laboratory, back to the doctor, to the pharmacy, and finally, the maternity ward. Together, we would learn how to make our hospitals more inclusive, respectful, and responsive to everyone's needs. The hospital visit begins at a record session, the gateway to care. When you notice that a patient is not responding to verbal greetings, approach them calmly, make eye contact, and smile. Then sign. Welcome. Thank you. Good morning. Good morning. Good afternoon. Good afternoon. Good evening. Good evening. Depending on the time of the day. How are you? Patient, I am not fine. Can I help you? I am coming to see a doctor. Is this your first time here? Yes, please, he or she responds. Okay, if the patient has a hospital folder, you can ask. Please, show me your hospital card and your health insurance card. Okay. Thank you. Wait here. I would find your folder. He or she replies, okay, thank you. Please take the folder to the nurses at the OPD. They will check your blood pressure, temperature, and weight. After that, you can see the doctor. Okay, thank you. Staff can also use gestures or write short messages on paper when necessary. For example, sit and wait until it gets to your turn to see the doctor. Or go to consulting room 3 and see the doctor. Okay. In the consulting room, accurate communication is vital. This is where diagnosis and treatment decisions are made. Start with a friendly greeting, such as, good morning. He or she responds, good morning. How are you feeling? I am not feeling fine. Then ask about symptoms using clear signs. What is the problem? He or she responds, my whole body is paining. When did this start? He or she responds, yesterday. Have you taken any medicine? He or she responds, no, please. Do you feel fever, headache, or cough? He or she responds, yes, please. Please go to the laboratory and do some tests. Okay. Next, we move to the laboratory, where patients go for tests. Common phrases include, you are welcome. He or she responds, thank you. Please sit here. Okay. Let me see your folder. Okay. I need to take your blood. It may hurt a little. You will urinate in this container. Wait for your results. Your result is ready. Take this back to the doctor. Okay. After laboratory testing, the patient returns to the doctor. Now, the healthcare provider must explain the results clearly. You can sign, the test shows malaria. I would get you some medicines to take and you will be fine. You need to go to the pharmacy and collect the medicine. But you will take one injection. So after collecting the medicine at the pharmacy, take it to the nurses for them to give you the injection. Make sure you take medicine as prescribed and come back in 7 days for review. If you feel worse after taking the drugs for 2 days, return immediately. Thank you for coming. Thank you. Thank you. At the pharmacy, deaf patients often struggle to understand dosage instructions. This is where visual clarity is most needed. Use simple signs and gestures. For this medicine, take one in the morning, one in the afternoon, one in the evening, before eating. Take one in the morning, one in the afternoon, one in the evening, after food. Finish all before you stop. Take the other medicine to the nurses. They will use it to inject you. Always confirm understanding by asking the patient to repeat the signs or point to the correct symbols. Before the patient leaves, sign. Thank you Get well soon. Thank you. Now let's visit the maternity ward, where deaf women come for antenatal and postnatal care. Pregnancy can be a joyful yet anxious time, especially when communication barriers exist. At registration, nurses can sign, "Welcome. Thank you. Are you pregnant?" "Yes." "How many months?" "1 month." "Is this your first baby?" "Yes." During antenatal checkups, key signs include: I will check your blood pressure. Lie down, please. The baby is fine. Come back next week. When given advice, use short and visual messages. Eat well. Drink water often. Rest often. Also take folic acid regularly. It is good for your health and that of the unborn baby. Okay, thank you. During delivery, communication becomes even more sensitive, so use calm gestures and signs like push, breathe. You are doing well. It is a baby girl. After delivery, breastfeed a baby every 2 hours. Come every 4 weeks for postnatal review. Keep the baby warm. Okay, thank you. Providing accessible maternal care empowers deaf mothers to give birth safely, confidently, and with dignity. It strengthens the bond between healthcare workers and the community. Communication is at the heart of healthcare. When we speak in a language that everyone can understand, we bring healing not only to the body, but to the human spirit. By learning basic sign language, you help make your hospital a place of inclusion, respect, and equal access. Together, we can make healthcare truly universal. Thank you for watching. This video is produced by the Center for Development and Policy Advocacy, CDPA, under the project Hear Our Signs. No More Barriers to Communication, and generously supported by the European Union and the Global Youth Mobilization.